afternoon, everyone. It is 1 o'clock, so we will get started right on time. We have lots of information to share with you today. Welcome to this month's member webinar hosted by Wisconsin Cheesemakers Association. I'm Grace Atherton, WCMA's Communications Director, and I'm glad to have you with us today as we dive into what you need to know about the current outbreak of highly pathogenic avian influenza, also known as HPAI or H5N1. First, a couple of housekeeping notes. Please mute yourselves to avoid interruptions during our webinar, with the exception, of course, of our Q&A section at the end. You can also share questions in the chat at any time, and we'll make sure to keep an eye on that and get those questions answered. This webinar is for member information purposes only and is not open to media. A recording of this webinar, along with a list of resources and contact information, will be shared with all of you later this week, so please watch for that coming in an email from me. With that, let's take a quick look at our agenda for today. First, we're going to turn to WCMA Senior Director of Programs and Policy, Rebecca Sweeney. She'll give us some insights and set the stage and share some data that we've received from WCMA members in a survey we have conducted in recent weeks. Then we'll turn it over to Secretary Randy Romanski of the Wisconsin Department of Agriculture, Trade, and Consumer Protection, and he'll talk with us about what we know now about HPAI. Next, we'll have Dr. John Lucey, Director of the Center for Dairy Research, talking about current food safety research findings as they relate to HPAI. Then the Wisconsin Department of Health Services will join us. We'll have Dr. Kate McCoy and Tom Haupt to talk about processing employee safety practices and recommendations. Then we'll hear from Adam Brock, also with the Department of Agriculture, Trade, and Consumer Protection in the Division of Food and Recreational Safety. And Adam will go over some tips for on-farm safety practices and messaging you can communicate to your farmer partners. Then we will have our question and answer section. We do have a number of questions that were submitted in advance, so thank you for those. We'll field those along with our presenters and any others that you may leave in the chat. Please know that if we don't have time to get to all of your questions, we will make sure that we get some information from our presenters that we can send to you in a follow-up so that we get all of your questions answered. And finally, at the very end, we'll share a couple of additional resources that we have available to you and close up for the session today at 2 o'clock. So now that we've gone through our agenda, we know where we're going. I'll turn it over to WCMA Senior Director of Programs and Policy, Rebecca Sweeney, who's going to get us started. Rebecca.
Thanks so much, Grace, for coordinating today's program. These webinars are always rich with information. And thanks to all of you, especially our presenters joining us today, for taking time to talk about this important issue. I know that while some of you have been following closely the outbreak of highly pathogenic avian influenza, sometimes referred to as HPAI, sometimes referred to as bird flu, and I think a lot of federal agencies are now transitioning to calling it H5N1, which is how I'll refer to it during this program. We want to make sure that we're all starting from a place of common understanding. So in just 1 minute, I'd like to get everyone set with a base level of knowledge. H5N1 is now widespread among wild birds in the US and globally. The virus has caused outbreaks in commercial and backyard poultry and also sporadic infections in a variety of types of mammals. H5N1 in dairy cows was first reported by the US Department of Agriculture, or USDA, on March 25th. Unpasteurized milk from some sick cattle was collected from 2 dairy farms in Kansas and 1 in Texas, as well as a throat swab from a cow in another Texas dairy. They all tested positive. And outbreaks have now been confirmed in dairy herds in 9 states. That includes Colorado, Idaho, Kansas, Michigan, New Mexico, North Carolina, Ohio, South Dakota, and Texas. Now, unlike H5N1 in birds, which is typically fatal, affected cows appear to recover when they're isolated from other animals and they receive care. That's good news. H5N1 symptoms in dairy cattle can include a sudden drop in milk production, thicker and more concentrated colostrum-like milk, a drop in feed consumption, loose feces, and some fever, pneumonia, or mastitis. In humans, it looks different. On April 1st, the Centers for Disease Control and Prevention, or the CDC, reported that a person in the US did test positive for H5N1 following exposure to dairy cattle in Texas infected with the virus. And that patient reported eye redness as their only symptom, and we're hearing positive reports on the recovery there. The patient was told to isolate and did receive an antiviral drug for flu. Both the FDA and USDA continue to reaffirm that the US commercial milk supply is safe because of pasteurization. And during this webinar, we're going to dive into that topic much deeper, so stay with us. This situation is dynamic and it's evolving. Literally right before I jumped on the webinar, I checked one last time for any more updates because they do seem to be coming in with frequency. It's also making headlines as you see ahead of you. Some of them, like the ones you see on your screen right now, may have triggered questions from your farmer partners, your employees, or your customers. And some of them may have triggered concern for you. It's hard not to be concerned when you see something about bird flu mortality rates higher than COVID, right? But it's important that we understand this issue before we go off the deep end, right? We want to be armed with knowledge. We did also want to get a read on WCMA member mindsets. So last week, we engaged in an instant data survey of our membership. That's something that we do that's a quick survey, and we get answers quickly as the title might suggest. Here's a look at a few things that we learned about where you're at on H5N1 response. First, it seems membership is split in its reaction, with about 29% reporting they are extremely concerned about H5N1 outbreaks and potential impact on the dairy industry. 42% say they're somewhat concerned, and 29% say they are not very concerned. Now, without revealing individual member responses, I can share that it seems like mid-sized operations were more likely to be somewhat or extremely concerned, mid-sized operations were the ones who were feeling somewhat or not very concerned. But then the chunk that's 29% who were extremely concerned were the largest and the smallest of our members. I also want to note that some of those small members are also producing raw milk cheeses. So another layer of concern involved there. We also wanted to take a look at how our members are communicating about this issue thus far. So about half of all of our respondents reported that they had communicated with their farmer partners with regard to H5N1. And nearly all of them reported that they had communicated verbally as opposed to written communication. Slightly more members had communicated with their employees by last Friday when the survey closed. 54% had noted they had been in touch with their workers with regard to safety practices, again, with most of them communicating verbally as opposed to in writing. Fewer members had connected with their customers about H5N1. And again, without revealing company names, I can share that mid or larger operations were more likely to have communicated. And in this case, more members had communicated in writing. And I think that it's fair to say, at least anecdotally, that's because their customers had requested that communication in writing. We know that a lot of that is retail communication or business-to-business partners requiring communication. Again, to affirm in most cases that pasteurization was occurring as part of the production process. Now, communication is critical to dairy industry stability when we are faced with crises, as we've seen recently. But that communication also requires knowledge first. And someone who brings both communication and knowledge to our program today is Wisconsin Department of Agriculture, Trade, and Consumer Protection Secretary Randy Romanski, who's here now to share more about what we know about H5N1. Secretary, thank you so much for joining us. And I know how hard you have been working over the past month and a half to quickly address some of the concerns of industry and to provide resources. So I want to thank you for that effort as well, sir.
Thanks, Rebecca. Thanks for the kind invitation and for gathering us all here today. You did a great job kind of teeing it up and kicking us off. I'll emphasize a couple things on the front end and then fill in some of the details. So I'll spotlight a couple things first. Things to take home with you when we're done here today, hopefully. A few things. Number one, biosecurity. It's key no matter what. We've been preaching that from our first messaging daily to whoever we're talking to. Biosecurity can really help contain, control, prevent spread of disease. So it's been a consistent bullet point for us in our communication. Number two, pasteurization. Pasteurization works. And Rebecca mentioned that there's been continual articulation that the commercial milk supply is safe because pasteurization helps kill active virus. So that's something we have been continuing to emphasize, making sure that consumers understand that the process works. And I'm sure Dr. Lucey will talk a little bit more about that. Another keyword, partnership. Communication is key. Let's just keep talking to each other. We are speaking regularly with partners about this issue, as we should be, because as Rebecca indicated, it continues to evolve. It's really important that we stay vigilant and that we are communicating with each other. Again, another reason why we appreciate being invited to conversations like this. I'll fly through a few details. With that as our backdrop, I'll fly through a few details of things that are worth noting. So Rebecca mentioned that there are 9 states that have had affected herds thus far. There are 42 herds identified in those 9 states that are affected. And that number has changed a little bit over the last couple of weeks, and I'll talk about that a little bit, because the federal government, USDA, has put in some guidance, some restrictions on movement of animals that I think will tell us more about this issue as it evolves, because testing prior to interstate movement of lactating cattle is the key. The initial instance of infection in Texas was believed to be from wild bird population into the dairy herd, and since that point, our federal partners indicate that they anticipate that there has been some cow-to-cow spread. I think, which is one of the reasons why USDA has indicated or has implemented federal federal testing restrictions of lactating cows. And mandatory reporting. I can talk a little bit more about that in a little bit. I mentioned partnerships before. I think the important thing to tell you all is that there is an ongoing network of communication. You've got some of our other partners on as well today, Rebecca, so thanks for connecting those dots. But DACAP has been in regular communication and continues to be in communication with USDA, Food and Drug Administration, Centers for Disease Control, the Wisconsin Department of Health Services, Wisconsin DNR, other federal and state partners and industry partners as well about the outbreak. Again, to emphasize something Rebecca mentioned, is that this presents differently in dairy cattle than it does in the poultry population. And the poultry population, high-path avian influenza leads to widespread mortality. What is being found in the dairy herds that have experienced this is that the animals do recover, and that they do get back to production within 2 to 4 weeks. So that is one big difference in how it operates in birds versus dairy cows. There's a variety of biosecurity measures that are recommended. DACAP has a website that gets regularly updated. We've got about 21,000 subscribed users to GovDelivery listserv. You can get to it at the DACAP website, dacap.wi.gov. Look for highly pathogenic avian influenza updates, and you can sign up to receive updates for whenever that happens if you are so inclined. I want to talk a little bit about the federal order. USDA has issued a federal order to reduce the risk of H5N1 spread among cattle and poultry. The federal order became effective April 29th. I mentioned a couple weeks ago, so that's the date. And a couple things that it requires that are of note. Number one, mandatory testing for interstate movement of dairy cattle. These steps are immediately required for lactating dairy cattle, and USDA requirements for other classes of dairy cattle are going to be based off of scientific factors concerning the virus and its evolving risk profile. At this point, USDA has not changed that order, but it is requiring testing a negative test of a lactating cow before it can move interstate. The other thing that the initial order requires is mandatory reporting of positive tests. So laboratories must report positive influenza A tests results to USDA APHIS. So that is one of the other requirements that the federal government can use to identify if and when this is spreading beyond that. The state of Wisconsin has not implemented any additional restrictions for intrastate movement at this time. And we are aware of the fact that there are tests being done right now. There have been tests that have been done in Wisconsin since the initial positive test in Texas, and at this point there have been no positive tests in Wisconsin, and we hope that we see that continue. A few other things that I would say just to kind of put people at ease is that there's, you know, sick animals should not be moved to begin with. There's certificate of veterinary inspection that would go with any animal that would have been going interstate. And we again encourage farmers to if they identify animals presenting as ill, to get that animal tested and take other biosecurity measures as needed. I want to be conscious of time, so there are a couple other things I want to make sure we're covering before we move on, because I know you got some other folks that you're going to bring in. I would say that USDA and our federal partners have continued to work with us on this issue, and they're making some resources available. And in order to protect against the spread between animals and humans, USDA is providing financial support for affected premises, for PPE for employers, and financial support for workers who participate in studies. There's some funding for biosecurity planning and implementation, as well as funding to heat treat and dispose of milk in a biosecure fashion, meaning that they don't want milk that may be from a contaminated herd and may have contaminants in it to be spread to go beyond that. So there's funding available for heat treating and disposal of milk. There's also some funding to reimburse for veterinary costs, which I think will be helpful. I know Adam Brock from DACAP is going to be on. He'll talk a little bit about some of what's going on with testing. I think Dr. Lucey will as well. So I'll leave that to them, other than to say pasteurization is proven to kill the virus. And I'm sure Dr. Lucey can go into deeper detail than that, but I'll start it off with that because that's something we continue to say.
Thank you, Mr. Secretary. Thank you.
Yep.
And you're exactly right. And a perfect transition, frankly, to our next presenter, Dr. John Lucey from the Center for Dairy Research. Many of you know him and we all appreciate him. He's going to talk a little bit now about some of those studies that back up that fact that pasteurization makes our milk supply and our other associated dairy products safe. He's also going to talk about some questions that you may all have about other types of dairy products or other forms of finishing dairy products that may be a question right now. We're very fortunate to have Dr. Lucey with us. Sir, thank you so much.
Thank you, Rebecca. And I'm happy to be on the webinar. So if you go to the next slide. So I want to talk a little bit background about resources that are on the UW-Madison campus that are basically involved in this effort. So I would just want to highlight them because I'll mention them a little bit later as we talk about some data and some studies. So for example, we have an influenza research institute on our campus, which is housed in the School of Veterinary Medicine. And Dr. Yoshi is our director there, and he has spent decades working on both this virus and Ebola and other types of virus. They do have a level 3 lab that is used for virus investigations for influenza, and they have been the ones who have been testing inactivation, as Randy mentioned, pasteurization and other kind of things, because they have that restricted type of access. If you go to the next slide. Within the vet school as well, we have the Wisconsin Veterinary Diagnostic Laboratory, and many of you may know its director, Keith Poulsen. So Keith also happens to be the president of the American Association of Veterinary Laboratory Diagnostics as well. So Keith is kind of the center point person with weekly or bi-weekly meetings, pulling together a range of agencies that are interested in this HPAI topic, including all of the major national and state regulatory organizations. These include the CDC, the FDA, the USDA, and all of their branches that are relevant, as well as all the state vets and associations, testing labs, as well as academics like myself and other people who are interested in food safety. So we talk through the range of topics questions we have, and try to get input and advice from whoever's doing the work, whether it's the vets that are in the field, what are they seeing on clinical symptoms, or from the federal agencies, what are supports are they doing or what kind of testing they're doing. So Keith keeps that call going. It's not for media, it's for basically the people who are involved in the activities. So if we go to the next slide. I would say then we have ourselves at CDR and the Food Research Institute, which are providing support and technical advice, particularly to Keith and to Dr. Yoshi, because they don't know milk and dairy products as well. So we provide a lot of technical advice to them, probably almost on a daily basis. I'm probably having an email or some sort of message from one of the other talking about some question that's come up, because they're coming from the vet or the animal side, and we're providing some advice on, let's say, the products and practices that are going on as well. So just want to let that landscape be known to people out there that we can't do virus work within CDR. And the Food Research Institute doesn't do virus work typically now either. They do pathogen work, but not virus work. So we have some specialized labs on the campus to do that work. So if you go to the next slide. So a little bit of background. We talked about a little bit of background, but I want to emphasize a couple of topics about the background that I think are very relevant. The first, and probably the reason why we're more worried than normal, is that the mammary gland, or the udder of cows, exhibits extremely high levels of the virus. So it doesn't seem to be like some types of influenza where you find it in the lungs or in respiratory cavities and things like that. It doesn't. It seems to be found in the udder at very high levels. So that's a big concern. That means our milk is going to have, from an infected animal, is going to have massive titers from it. It is not known yet, at least I'm not aware of it, but there is speculation that mammary gland could be the epicenter for where the infection first starts. Why? Because there are some receptors in the mammary gland for this virus, and that might allow them to get a foothold and then start to do infection and multiplying there. We don't know that for sure, but that is one of the plausible theories going on right now. And that could explain why we're seeing such high levels of titers of virus in the mammary gland. There is unclear how this cow-to-cow transmission is taking place right now. One speculation is that during the milking process, because these are lactating animals, as Randy mentioned, and it could be true in the milking kind of process. However, it could be by other means, we know that, for example, mastitis and other kind of diseases can be transferred by a variety of means to the cows, maybe through their, contamination on the teats of the cow or something. That could be true. But it could also be that it's during the milking process, but we don't know yet. We have mentioned already the cows become sick, milk production goes down. The milk itself appears discolored. I would say looks more like mastitis or colostrum. But thankfully, most cows seem to recover within a few weeks, unless they have an extreme case of it. We also know that some cows are asymptomatic, but do test positive for the virus. And this might be a concern as we start to transfer cows that don't appear to be sick, or we milk cows and we don't appear to be sick, and that virus then would go into the milk supply. So that's a concern. If you could go to the next slide. There have been communications that haven't always been helpful. I'll be perfectly honest. So this first communication that bird flu virus had been found in pasteurized milk really wasn't delivered, in my opinion, in a fashion that allowed people to understand what that meant. So this DNA-based technique, this PCR technique, detects fragments of virus, even if it's live or dead. So it didn't really tell us that much, because it could be telling us that pasteurization is doing its job. We would detect DNA from pathogens in pasteurized milk, but that wouldn't be a concern to us either. Pasteurization does not remove the dead virus, just like it doesn't remove the dead pathogens. However, to me, it does indicate that the first roadblock, our first barrier for the FDA and the pasteurized milk ordinance, which is milk from infected animals should not go into the supply, that didn't work in all cases, because we were detecting virus in pasteurized milk products. Dead virus, yes, but it indicates it's in there. So we are really truly relying on pasteurization to prevent this virus being active in milk. If you go to the next slide. Let me talk a little bit about pasteurization. Because we are not able to test it in real pasteurizers that look like something in your plants, Yoshi's lab, probably over a month ago now, got infected milk samples from farms in Texas and labs in Texas, and used a lab-based technique. It's actually a thermal cycler. It's a unit to do heating. And they did a range of pasteurization times and temperatures to test to see if the virus was inactivated. Both of the two standard pasteurization treatments used in our industry, which is the 161 for 15 seconds, which is the HDSD process, or the longer term batch process, which is 145 degrees roughly for 30 minutes. Both of those resulted in infected milk that they had tested that had no infected virus, active virus after the heat treatment. And they did a bunch of longer hold times as well, but all of them had no active virus. This information has been communicated to all the national regulatory organizations. They're aware of it. However, the UW will not be making an official statement. That's not our place to be doing it. We're the academics. Any official statements, as you see over the past month or so, have come from the FDA as they give updates on their process, because they have the legal responsibility and guidance for pasteurization. We are currently doing further testing on infected milk, and we also at CDR had giving them control milks, because they also want to know what does the numbers look like in these tests for ones that don't have infection. If you go to the next slide. Oops, I think we went too far. Maybe one slide more. Back. Yes, so the FDA, they did test retail samples. They didn't tell us where they came from, but they also didn't find any active virus in those. And also supporting evidence is really this virus is similar to the virus found in eggs, and at that lower temperatures than what we use in pasteurization have been proved to be effective in doing this. They are doing their own research. They have told us that they're installed a small pasteurizer unit and they're putting it into a lab in Athens, Georgia. They're hooking it up. They just said there was a delay of getting the appropriate power for this into the lab. And so they're telling us within the next couple of weeks, they will do the same kind of time temperatures in a kind of a realistic pasteurizer compared to a lab unit. And we can expect to see that soon. We're also interested in looking at non-legal temperatures. So they could be, when we use the word, Rebecca used the word raw, some people not meeting the definition of pasteurization, but everything then from a legal point of view is raw, but they actually might be heating at some time temperature. And so we're going to look at a couple of temperatures and times. The first one we asked them to look at is around 149 Fahrenheit for 15 seconds, but we're going to look at a few and see if there's any active virus after these time temperatures to give guidance back to some of our raw processors. We've also developed a very simple fractionation test of milk to look and see where the virus is going in milk. For example, is it going to be all in the cream or the fat, or is it going to be in the sediment layer? In fact, with these kind of simple tests, we found virus and detective active virus in both the cream layer, the skim layer, and the pellet. The pellet would be something like your clarified materials, like your spores and your somatic cells that could come out if you're clarifying the milk before processing. Let's go on to the next slide. We are trying to develop a model cheese system, but it has to be something that will fit inside this small, very secure level 3 type of lab. And we're working with them on possible methods to develop some model cheese testing so they could spike cheese and see if it's viable. A couple of things to mention as well. Infected milk did not clot. We gave them some renneting testing. They could not clot the infected milk. It probably is something very like mastitic milk, might have a high pH, hydrolyzed proteins. It didn't want to clot for them at all. So we don't want that milk going into a cheese supply in the first place, but we were interested to try and make some model samples from it. We were trying to get a small lab pasteurizer into the virus lab here, the IRL lab, but actually it's too big to do with their biosecurity and containment system. So that plan is kind of stopped at the moment for us just because of the limitations of that lab. There was work done back in the 1970s, actually on the UW campus, that looked at cheese as a vehicle for virus. And it wasn't a very good vehicle, and they did not stay active very long. And even mild, much lower than the thermization process I talked about there, actually showed that it was inactivated quite easily by low temperatures, much lower than pasteurization, and it didn't stay active over any period of time. So again, not exactly our virus, but related influenza viruses. There is some old data on this that's maybe of relevance that we're looking at. That was from the 1970s. If you can go to the next slide. Where am I worried about, and where I think our industry has some gaps or risks from dairy products? Obviously, raw milk and any raw dairy products. The rumors, and I actually was reading some studies that it was pretty conclusive that cats who drank infected milk on these farms died, and it had a high proportion of them die. So raw products are obviously the major concern here. And I see rumors that the incidence of consumers drinking raw milk has spiked in the last couple of weeks, which is very alarming. We don't know yet if sub-pasteurization or thermizing is effective and what temperatures to give guidance to our raw processors. I would be concerned about the whey from raw milk cheese, which is often fed to animals, pigs, cattle, etc. That is very likely to contain virus if that milk was infected. So you could be literally feeding virus to cattle and propagating the disease. So that would be a concern for me. Any raw milk filtration, and we know there's some filtration processes, a few commercial ones that go on, and some do not do it after pasteurization. The permeate could contain virus. In theory, if you did a reverse osmosis or did some other filtration, it should retain it. But I wouldn't be guaranteed that the filtrations work 100% of the time. So again, you have to worry about where that permeate is going, especially if it's going to cattle and feeding. You could be propagating again. And the other question could be the first milks that come out, the colostrum. It really should be pasteurized, and that's the recommendation and best practice for our vets. But I don't think everybody's doing that, and it probably is fed to calves. And again, we could be propagating the disease again, so we have to watch out for these kind of things at the farm level. Next slide, please. So I think, the FDA is really talking at the moment. It has a general kind of guidance against raw milk products, but it's also talking about don't use infected milk for making products. That seems like very, very sound advice. So thank you.
Thank you so much, Dr. Lucey. I feel like a number of things that maybe cause for concern, but it's also very encouraging to see the progress that's being made already in terms of testing this. I know there are a number of questions that have come in the chat for Dr. Lucey, and we are going to save all of our Q&A till the end so that we can get through each of these topic areas. But thank you so much, Dr. Lucey, and please don't go anywhere. Okay. Next up, we've talked about the safety of dairy products for consumers, but we also need to consider the safety of our workforce, the value team that you trust every single day to make your product line. WCMA has appreciated a very close working relationship with the Department of Health Services, certainly through the pandemic. In some cases, we were talking daily, and I hope that we don't do that with this, but I am grateful that our relationship continues as we learn more about H5N1. Joining us today are Dr. Kate McCoy and Thomas Haupt. Both of them work for the Wisconsin Department of Health Services, and they are here to share with us some of the latest recommendations about this potential threat. Thank you so much for joining us both.
Oh, thank you. Am I coming through okay? I was having some trouble with my headset.
You sound great.
Okay, good. Whenever I go from remote to working in the office, something seems to be going wrong. But as long as you can hear me, thanks for Kate for coming on as well. I just got your email that your other meeting was running late, so thanks. But I could just start off a little bit about some of the PPE issues. CDC about a week ago put out some recommendations, which really came as a surprise to us. And that would be a one-time offering of PPE to dairy farm workers who are exposed to potentially infected cows or raw milk before it's pasteurized, that type of thing. It really was not clear how much should go out. I mean, are we talking 2 changes a day for 7 days? We're really trying to get more clarification as to what's expected from us as the Department of Public Health, the Division of Public Health, as to what we have in stock, what we need to give out. They mentioned a one-time basis. If somebody asks for a second dose, a second allotment of PPE, are we going to deny that? Or are we going to make sure that they get it? A lot of questions need to be answered at this particular point. But the big thing that CDC has been looking at, and they put it on all their meetings, is they want to protect the workers as much as they possibly can. They think this is, since we only had the one case in the worker in Texas, and it was a relatively mild case of conjunctivitis, but they really wanted to push getting this availability of the PPE out to the farmers. But it also think about the slaughterhouses. We're thinking about, we're not going to forget about our commercial turkey farmers, those types of things. Certainly cheese factories that get raw milk in, they could certainly qualify for this PPE as well. But right now in our cache, we have vinyl gloves, we have coveralls, we have face shields, and we have N95 respirators. We did not have boot coverings, we did not have goggles in our cache at this particular point. And just to note that this is not an unlimited supply. And we really don't know what kind of response we're going to get. I mean, is every farmer and every slaughterhouse going to want this? In which case we could run out very quickly. If they don't want it, maybe we don't send much out at all. We just don't know what to expect. This is all brand new, and we've been working very diligently with the Bureau of Environmental Health and Occupational Health, where Kate is from, and with our Office of Public Health Emergency, otherwise called OPEC, at the State Department of Health Services. But this is something that, again, it will be offered. We will clarify it. We will get this information out to people as quickly as we can, how to do it. There are some drawbacks with the PPE as well, and people need to know about that if they're wearing it, they're going to have to wear this 8 hours a day. And if you're wearing coveralls 8 hours a day and a face shield and or goggles, I mean, it's going to be very, very uncomfortable. So we want to make sure that if people are ordering it, they're using it, they want it, they need it, and they're going to use it in an appropriate manner as well. Just real quickly to deviate on PPE issues, we're also monitoring the workers at these particular sites as well. That's part of my job specifically. I'm the State Influenza Surveillance Coordinator, and we're working to, again, identify people who may have been exposed, find out if anyone has symptoms, get those people tested as quickly as possible. And this is something that would be, we have a courier system where we can get the swabs taken, whether it's a swab of the eye for conjunctivitis, nasopharyngeal swab, or nasal wash. Get those specimens to the Wisconsin State Laboratory of Hygiene, and within a 24-hour period, we'll have test results for you on everything except the conjunctival swabs. They have to go to CDC at this particular point, but we're working to try to get that changed as well. So, Kate, I'll turn it over to you for some more input on this. Thanks for coming on. Appreciate it.
Yeah, thank you, Tom. Thanks so much. Tom is really right there in our preparedness efforts. We're not in response efforts right now because we don't have any instances. We're in preparedness. Yes, I oversee the Occupational Health and Safety Surveillance Program at DHS. And so we did, as Tom mentioned, we got these recommendations about PPE use. He was talking about the state and or the feds can make PPE available. But generally right now, there is a recommendation of making sure that workers are protected if they have contact with raw milk, with lactating dairy cows, with any kind of saliva, mucus, feces, potentially contaminated surfaces. So if they're involved in going on to the farm site and transporting things, transporting milk products, if they are, touching any surfaces that raw milk has touched, if they're involved in less for dairy processing, but operations around culling dairy cattle or certain kind of slaughtering operations, then there are full PPE recommendations. And as Tom mentioned, we know there are drawbacks to that at the same time, because there's not as much known at this time about what's going on. The precautionary principle is sort of what's being emphasized, as well as hygiene practices, of course, washing hands, being careful about cross-contamination, reminding people not to be touching their phone if they've been touching any of these surfaces or substances. I think it's an easier sell in the dairy processing side than it is on farm to talk about PPE, but correct me if I'm wrong here, Rebecca. I think you folks generally have more of that orientation from where they're coming from. Go ahead.
I mean, the good news is a lot of folks are already wearing gloves. In some cases, they're already wearing eye protection. It's, I think a lot of the conversation over the last, and frankly, the last 24 hours is when we received clarification from the CDC that their recommendation related to PPE for those working around raw milk was applicable not only on farm, but also in processing facilities. So a lot of the conversation over the last 24 hours has actually just been about the face masks, right? Yes. And whether it's required or it is recommended. At this stage, please let me know if you know otherwise, right? At this stage, we're aware of it being recommended, but not essentially required. That said, I'm also aware that OSHA is looking at this and may also have some guidance for affected processors in the days or weeks ahead. So it'll be something that our processors will have to pay attention to as it's rapidly evolving.
Correct. And I think, one of the things that I think became a little clearer, it's in that conversation you were talking about yesterday, was the written guidance is about infected or potentially infected dairy cows, right? The problem is, or the products from potentially infected dairy cows. The problem is we may not know that. You may not know that you're handling milk that doesn't look weird, that wasn't dumped because the animal wasn't acting, wasn't showing signs or symptoms. So it's the potential is there for things to be contaminated without knowing it, and that there can be spread before an animal is symptomatic. So that is the precautionary principle, not a mandate, for folks to be extra cautious at this point in time and taking these PPE recommendations to heart.
Yes. So we have a number of questions associated with that, but I think the main takeaway from our friends at the Department of Health Services is that they're in the same boat as we are, right? They are getting information from federal partners that still needs to be fleshed out. And that may take some time. So it's critically important, I would say, that right now, you keep paying attention to these alerts. I think that we all have a little bit of crisis fatigue, and that's understandable. We've just been through a multi-year pandemic and a variety of other challenges in the dairy industry. So folks are exhausted at these kinds of thoughts, but it is critically important to your ongoing operations that you stay in the game on this. And we're very grateful that DHS will be a good resource. And I'll hand it back to you, Kate, for some other thoughts before we go to farm side with Adam.
Thank you, Rebecca. Just really quickly, I mean, one thing I will add is you all and the folks you work with can be a critical piece of this puzzle, right? So the way that the science develops here is folks seeing something and saying something and coming forward and reporting and having that opportunity to detect, if there are any instances. So if you can get that word out as well, that's very helpful. Thank you.
Yes,
just one thing, if I could just add one thing quickly. There's been a lot of talk that the state is going to be supplying antivirals to people who are infected, or either as a treatment or as a prophylactic. We do not have a stash of antivirals at Wisconsin. I know the meeting yesterday with Senator Baldwin, where Secretary Romanski was on the panel as well. It was mentioned by one of the people that Wisconsin does have a large stash of antivirals. We do not. What we are trying to do is get a small stash purchased so we have that instance where if a worker does not have insurance or does not have a primary care provider, to perhaps fill that gap temporarily and getting some antivirals, because again, with treatment, it has to be done ideally within the first 48 hours. But I just wanted to clarify that the fact that we do not have a large stock of antivirals, we're trying to get a very small one, maybe 100 doses tops, that we could use as a bridge in case we run into that particular circumstance.
Thank you so much, Tom, for that addition. And thank you, Dr. McCoy, as well, for your time today. We really appreciate it. I think Rebecca's dealing with some minor computer issues at the moment. So I'm happy to introduce our next presenter. Adam Brock is the administrator. Yes, are you back, Rebecca? Oh, I think she might still be working it out there. I'm happy to introduce our next presenter. Adam Brock is the Division Administrator of the Division of Food and Recreational Safety at the Wisconsin Department of Agriculture, Trade, and Consumer Protection. And he's here to talk with us a little bit more today about what messages dairy processors might share with their farmer partners to promote safety. Many of you may know Adam from his time at Dairy Farmers of Wisconsin, so he has quite a bit of experience in this arena. Adam, if you're ready, I will turn it right over to you.
Yeah, that's perfect, Grace. I will be short and sweet. As many of you know me, I like to hit some key things. Secretary Romanski, DHS, Dr. Lucey, you've all done a great job. Thank you for the invite. I will keep it short to help with the timeline. What I would like to focus on is 4 key things, and you might need to write this one down because I use slides, but not today. Number one thing to remember is biosecurity. You have a biosecurity system on the farm, right? And processors understand what I'm talking about when I talk about biosecurity. There are references, there's things like secure milk supply for regular biosecurity that has been integrated into the farm program. So if you need those resources, they're available. In addition, DATCAP has some biosecurity pamphlets. Again, we've had these for a number of years, but it's always good to check on biosecurity and know what's going on at the farm. And the farmers are there every day. They will make sure of that. Speaking of other resources, I know DFW has some resources for tours, right? We're all about ag development, growing markets for farmers. They've got some tour guidance. So there's tools and resources which we'll provide to WCMA, and make sure we get those tools to you. But think about biosecurity, number one. Number two is herd health. Our farmers, our vets, even on the meat side, the vets are in the plants. They're there looking at herd health. We can't always tell if an animal is sick, but make sure you're monitoring it. Look for signs. If you don't see signs, make sure you're working with your partners, work with veterinarians. If you do see identifiable issues, Be sure to follow protocol with a hospital pen, with quarantine in the sense of keeping the animal away from others, but just make sure that you follow and keep an eye on herd health. The third one is really simple, and I have noticed it's not out there much, but sanitation, general sanitation. Many of you in the food industry know about sanitation. There's still sanitation that's occurring on the farms. I would like to comment that there is an EPA list of antimicrobials for avian influenza. Maybe not this particular strain, but EPA does have a list similar to what you saw with COVID. There were certain commercially available chemicals. So work with your chemical suppliers. And again, we can send you the list. I haven't seen it out there, but simple sanitation. Think about how much you do in the plants. Remind the farms as well. They work closely on sanitation, given some of the thoughts around transmission, but there are tools available. And the last one I would say is PPE. The importance of PPE, we've heard more about it over the last several days. One of the key things is educate on how to properly use PPE. We saw this again during a previous pandemic, and just provided insight on giving people PPE is one thing, teaching them how to use it properly is another. So if you're going to use it properly. And remember, we're trying to reduce the risk. Risk will never be zero in life, but we are trying to reduce those risks. So take these tools and move forward. I'd say the last thing I just want to leave the group with, and then I will transfer on back to Rebecca, I believe, is two things. One, we are working for the brand of Wisconsin agriculture. I know many of you have heard this before. You each have your own brands. We're working to help you protect the brand of Wisconsin agriculture. We want to work through this with tools, resources, and data as we move forward, and not let fear stop us from moving forward and developing new opportunities and markets. And while we go through this, I want to emphasize an important thing to me, which is the kindness component. This sounds like out of the realm of what we're talking about today, but realize that farmers, this is their life and their livelihood. And when you're talking to them, they are passionate about it. And it's important to remember that they're coming from a place of, we want to do the best thing, but there's a little bit of that fear, I think, deep down, because we don't know where this could go. So just remember, when interacting with the farmers, kindness is of importance. Work with them. If they have questions, answer them. So with that, I tried to keep it short. For Rebecca, we want to keep on time so we can get answers to your questions. But if you have questions about the resources, I will pass them on to WCMA, and they will be included, I'm assuming, in a follow-up email. So with
Absolutely.
that, I will hand it back to Rebecca.
Appreciate so much that kindness component, because everyone's stressed about this, and they're stressed about a million other things too. And trying to lead with that kindness through a crisis situation can go a long way to making sure everyone gets through things well. We're going to transition now to our question and answer time. I will say to all of our presenters, we have gotten a lot of questions, so we'll try to keep answers as concise as we can. But we will start with pre-submitted questions, so we'll transition back into our slide deck at this moment. I'll wait for Grace to make sure that I'm reading the right one.
Okay. I think we've lost Rebecca again, so we'll go to our first pre-submitted question here. Is anyone studying the food safety of raw milk cheese? And if so, when can we expect findings? Dr. Lucey, I think that one is prime for you.
Yeah, Grace, so it is started, but the limitation here is all of this work has to be done within these level 3 biosecurity labs. So we can't make the cheese and do any testing in it. So we're trying to downscale and make micro kind of batches of cheeses, that procedures that they could actually make in the lab to test it. So I'd say we're a couple of weeks away from that study yet. But we are going to go ahead and do the thermizing process if they're in this raw, but they may be thermizing, and we should have some data on that soon.
Okay, Rebecca, you want to take our next
Yeah, we'll continue forth. So sorry, everybody. Apparently, I need to put on my other hat and do some lobbying on broadband. The next question is about PPE. Do you have any recommendations on the best kind of face mask for processing workers handling raw milk? And any leads where I can buy in bulk? Or do you know if processors will be receiving some of those supplies from the federal government? I think this is probably a question for our friends at DHS.
Yeah, as far as recommendations of face masks, the key is the tight fit around the nose and the mouth. And ideally, the one for that is the N95. And as we mentioned a little earlier, drawbacks, N95s really have to be fit tested, for them to be effective. As far as where to buy them, I don't have any recommendations. We always encourage people to look and try to purchase these on their own. But if you cannot find them, that's where ordering or requesting something from our stockpile comes in. And it's on our DHS website. I don't have the actual URL for it, but there is a way to order that through our Strategic National Stockpile statewide if they are not able to purchase these and can't find these things.
I recommend that you take that action soon. We will send that in a follow-up email to you all. So any of you in particular whose smaller teams are handling a lot of raw milk, let's try to connect you in that way. We'll move on to our next question. And that is, how do we screen raw milk for odor if employees are wearing respirators? I know this came into the chat a couple of times as well to me. In addition to being sent in advance. So a key question, and maybe something for our friends either at CDR or DATCAP. Obviously, one of the steps as we go through food safety is an odor screening. Any recommendations if folks are wearing respirator masks?
Well, just one comment. What we're hearing is that the milk also is discolored. So I think that might be another key kind of visual clue, even if someone was wearing a mask or a respirator. And I think if the animal has a severe infection and the levels of virus are very high, it doesn't seem to be a normal looking milk. It looks thicker. It looks more like colostrum and stuff. So anyway, that's would be my suggestion.
I think another thing just to note is, again, with evolution here, I have sent this question as well to some of our friends at USDA for their additional consideration, because if they are recommending that all of your employees handling raw milk wear respirators, those kinds of masks, it will be challenging for you to execute this. So it's a good question and one we'll continue to follow up on. Next question. Would we be notified by federal or state officials if one of our farmer patrons is testing their milk for bird flu? That's I hope that everybody has very good open lines of communication with their farmer partners. But I think this gets to the point that was raised earlier, which is sometimes there's a temptation perhaps to just continue forth. So would there be any sort of notification to a processor if a farm was investigating their milk? Secretary.
Yeah, Rebecca, I can start on that one at least. I agree with you that first step is having good and open lines of communication with your producer members, partners, and I think that's a great place to start. I encourage people to have that conversation if they haven't already done that. From the perspective of those involved with the testing process, it's a process that starts with the farmer, the veterinarian follows up with the lab. Then there would be some follow-up screening and epi testing. There's a process that goes along with that. So that's the communication chain we would be working through primarily, since they're the initially affected party. There's a communication chain that happens along with that, obviously, because it's not in a vacuum. It's just that first contact, if that's maybe reading the question too literally, but first contact is farmer veterinarian testing, and then we just kind of expand the system from there.
I think it's good to have a proactive conversation with your farmers. I think that's good advice, Mr. Secretary. What would happen if something occurred? What is the expectation? as the, that you have as the buyer of their milk. We're gonna move on to our next question, and that is, should we be sending milk samples in to be tested for H5N1? I think the short answer is not right now. Dr. Lucey, Secretary Romanski, can you second that? Not yet.
I think one of the issues that's a little bit of a struggle right now is that there's a lot of reluctance from farmers to test because it's unclear to them what the impact would be. I'm talking about across the US, I'm not talking about Wisconsin. So the vets are really struggling with this and farmers are really struggling with it because I don't think they're fully sure what that means if one animal is testing positive. Does that shut down the farm, or is all milk blocked? Are they going to be compensated? All kinds of questions are coming up, but I think what we're seeing right now is a general reluctance for farmers to test. So I think we're in this kind of early phase of trying to figure out, well, what does this testing? Is it bulk tank testing? Is it kind of like dairy testing? Who knows? It's a little bit unclear right now.
Rebecca, the only thing I would add to that is this is actually a nice flow from the previous question, in that as of now that the testing is coming at the farm level with veterinarians and herd owners, and if that guidance does change, we would certainly make sure that communication comes back through to all of our partners.
All right, I know we are at time, but I am gonna try to sneak in a couple of additional questions because I think that this one we can skip. We're gonna go to one that was in the chat. I think that it's worthy of conversation. Have there been any recommendations or discussions around changes to cleaning and sanitation processes? I know that the EPA has on their website a list of approved sanitizers that kill H5N1. But want to ask our panelists for any changes that they're aware of in terms of food safety protocols in a processing plant.
If nobody else will go, I can go, Rebecca. I'm not aware of any changes. A lot of those items on the list, if you look at the chemicals, are already in use in the plants. There's a lot of quats and things that if you work with chemical suppliers, they will be able to direct you. And part of it will be determining the frequency, what you feel you need to do for your plant or your farm. I'm not aware of any guidance out on changing frequency right now. It would be best to always check your sanitation plans. And if you have concerns, increase the frequency of sanitation. So can't really help you much there, but we're trying to provide what we can.
I think the good news is folks are already doing very robust sanitation practices if they're following good food safety plans. So that's something that works in our favor in this kind of scenario. There are a couple of other quick questions.
Rebecca, I was just going to chip in a little bit, just a couple of added comments. So I was just going to say, in general, what we know from this in terms of eggs, because it's been there for quite a bit of time, is that they are sensitive to temperature. So a lot of studies have been done and shown the temperatures of 140 or above start to inactivate this virus. So that's good for us in some of our heating processes during the sanitation and cleaning. They also seem to be sensitive to things like acid and other kind of treatments as well. And so we don't fully know all the things about this particular outbreak yet, but from related ones, it gives us confidence that chemicals and acids and temperatures, the things that were the bedrock of our sanitation cleaning, seem to be very good against these kind of virus.
That's great. I'm going to sneak one final question in. Other questions that have been entered into the chat, we will try to address in a follow-up email to all of the registrants. But this is a question again for you, Dr. Lucey, and it's about what additional studies we can expect. Do you think that the book is closed on the milk supply is safe, end of story, period? Or are there additional tests coming that we should be aware of or potentially brace for?
Well, as I mentioned, the FDA themselves are setting up their own, let's call it a pasteurizer type of testing in Athens, Georgia, and I think they are expecting to have data from that soon. They had some delay in just getting it rigged up with power and things like that into the lab. So I think they're going to do it with a let's call it a realistic kind of HTSD, kind of system. I think we're going to have to explore more about the thermizing process, the cheese process from raw milk. And we have been actively, kind of reaching out to industry for practices or processes that we thought maybe a little bit on the bubble, that might be a little bit concerning to us. So we've been actively going out and talking and asking people to contact us and discuss through maybe things, that additional steps they could put in there. But the good news is, as Randy said earlier on, pasteurization, thankfully for this virus, is protective, and thankfully it doesn't seem to transmit very well to humans. It isn't really something that seems to like very much our lungs and respiratory tract. So again, these are all very good news for us. If that changed, that would be a whole different ballgame.
Thank you so much for that information, and thanks to all of our presenters for sharing what they know about H5N1 now. Sometimes you feel like you do a webinar and it could be a 2-hour long webinar instead of a 1-hour long webinar. And this is one of those topics where I just want you to know that WCMA commits to being nimble and scrappy and getting you practical information in real time. So if news warrants, we'll do this again. We'll do it again randomly if we have to, right? We want you to know that you're supported and that we can get you the information that you'll need to protect your products, your people, and your customers long-term. We're all in this together. Additional resources are available on wischeesemakers.org. We have a dedicated page, as does USDA, FDA, and CDC. Many of our industry partners, other trade associations are also being responsive. And I can tell you that everyone that we had on this webinar right now has made this their number one priority. I know that all of them would address your concerns quickly to be supportive of you. So you have a lot of resources, and we want you to remember that as you face this head on. I'll toss it back to Grace for some closing remarks.
Thank you, Rebecca. Just want to make one last mention of WCMA's webinar series. We have one more webinar coming up again next month, Navigating the Future of Sustainable Packaging. That'll be on Tuesday, June 11th at 1 p.m. Central. We'll have some of our trusted supplier partners from the dairy processing industry talking with dairy processor members and manufacturers about how they can prepare to navigate the future of sustainable packaging. That event is open right now for registration on our website, wischeesemakers.org. And you'll also find more information about H5N1 and a whole host of other resources and information there as well. And as a reminder, we will send all of this out in a follow-up email later this week. Thank you so much for joining us. Thanks again to our presenters, and we hope you have a great afternoon.